Hi, my name's Ayana James, and in this video I'm going to be talking about kennel cough, which is an upper respiratory disease found in dogs and cats. In this video we're going to be talking about prevention, symptoms of it, its diagnosis, and how to treat it. But first of all, we're going to start with a little video about a dog going to the vet and how it finds out that it has kennel cough.
Hello.
Hi, Ms. Turner. How are you?
I'm good. How are you?
Good. How's little Scoot doing?
Well, he's doing okay. He's been acting a little weird lately.
What's wrong with him?
I don't know. Whenever I pet him, he feels really warm. His nose has had some weird, discharge, and he's been coughing a lot. And when he coughs, he's been coughing up this weird white, goopy discharge. It's kind of weird.
This sounds really familiar. Would it be okay if I examine him to see what's
Sure.
going on with him? Okay, so his fever's coming. He looks like he has a fever of about 105, which is a little high for a dog. So, like I said before, these symptoms do look a little familiar. I'm thinking it's kennel cough.
Kennel cough?
Yeah, kennel cough.
What is that?
You and the client in this video are probably wondering exactly what kennel cough is. So as I said before, kennel cough, also known as infectious tracheobronchitis, is a common upper respiratory disease found in dogs and cats. It can be caught a number of different ways, like contaminated objects, spending time in crowded areas such as kennels and animal shelters, and from contact with other animals that have the virus. Kennel cough is typically not just one infection, but a combination of a bunch of bad bacteria and different viruses, with Bordetella bronchioseptica being one of the main ones. The most common trigger for kennel cough is the bacteria Bordetella and the parainfluenza virus. In adult dogs, the sickness is typically mild, but in older dogs and young puppies, the illness can be much more severe. This may sound intense, but there are preventions to help protect pets from this virus. The Bordetella vaccine is the vaccine that helps protect animals against this illness. Not all dogs and cats are given this vaccine, mainly because not all dogs and cats are likely to come in contact with the organism. For example, a dog who's around other dogs in boards and kennels has a greater chance of contracting this virus than a dog who stays at home all the time. The vaccine can be delivered two different ways: intranasally through nasal drops, or through a subcutaneous injection, which is an injection under the skin. Dogs have the option of both, though the intranasal option is more common than the subcutaneous. Cats, on the other hand, only have the intranasal option. According to the guidelines recommended by the American Animal Hospital Association and the American Association of Feline Practitioners, puppies can be vaccinated with the intranasal option as early as 3 weeks old, and their second dose should be given between 2 to 4 weeks. Kittens can get vaccinated as early as 8 weeks old. Puppies can get vaccinated as early as 6 to 8 weeks with the injectable option, followed by a booster 4 weeks after. Dogs older than 16 weeks of age should be given the intranasal vaccine once, and the injectable vaccine should be given twice, 2 to 4 weeks apart. Dogs should receive boosters every 6 to 12 months depending on how high their risk for catching the virus is. Cats older than 16 weeks old can receive one intranasal vaccine with an annual booster. A veterinarian may advise against getting this vaccination if the animal's immune system may not be strong enough, the risks of the vaccine outweigh the benefits, or the animal is sick or pregnant. Symptoms of minor cases of kennel cough include a dry cough, gagging, nasal discharge, fever, sneezing, vomiting, and the coughing up of white phlegm. These typically appear within 2 to 14 days after exposure. More serious cases of the infection can cause the dog to lose their appetite, develop pneumonia, or die. Because they have a weaker immune system, puppies and older dogs are more likely to have a more serious case of kennel cough than an adult dog with a good immune system. So now that we've covered what kennel cough is, how to prevent it, and the symptoms of it, let's discuss the diagnosis and treatment of it. So the diagnosis is usually made by observing the symptoms that I've mentioned previously. Additionally, blood work bacterial isolations, bacterial cultures, and even x-rays may be used to figure out exactly what type of kennel cough was contracted or if the animal has bronchitis. Most cases are able to resolve themselves without help from a medical professional. Symptoms usually last between 10 and 20 days, and complete recovery can take up to 3 weeks in a healthy adult animal. In a younger or older animal, it may take a bit more time for the patient to recover. If the symptoms don't begin to improve within a week or get worse, the patient should visit the vet. Some vets may administer antibiotics in cases like this. For additional help at home, the pet owner might also want to try using an air humidifier or some sort of water vapor to help reduce coughing. Also, collars may press against the trachea, triggering a coughing episode, so using a harness over a collar is highly recommended. A common misconception that some people may have about the Bordetella vaccine is that some people think that since their pet has this vaccine, their pet can't get kennel cough. This is incorrect. The Bordetella vaccine protects against the main bacteria known to cause kennel cough, but that's about it. All other bacteria and viruses aren't covered by this vaccination. So now that we have a basic understanding of what kennel cough is, how to prevent it, the symptoms of it, its diagnosis, and how to treat it, let's check back in with our patient Scoob in the video and see what his vet has to say about him and what she's going to tell his owner. Scoob has kennel cough. You might want to isolate her from other dogs until she gets over it, which should be about 3 weeks. Other than that, she should be okay. To help with her breathing, you might want to get a humidifier or some type of vapor to help her with that. Also, if you have any smokers like in the house or around her, that wouldn't help because it'll help block up her passageways. Sometimes when you walk her, her collar may go against her neck a little bit, which may stop her from breathing and she'll start coughing. So sometimes you might want to put a harness on her until she gets a little better. But like I said, that should take about like 3 weeks. If it gets worse, you can come back here. We can give her an antibiotic, but she should clear up without the antibiotic and she should be fine. But like I said, if you have any problems, you feel free to call us.
Okay, thank you so much.
Thank you. Have a good day. Thank you so much for taking time out to watch this video. Also, a big thanks to my RA Lindsay for acting as Scoob's owner in this video. Here I've listed my sources that help provide information for me to make this video. And again, thanks so much for watching.